Today, 17th May, is the World Hypertension Day, and I'm going to talk something about hypertension, that is high blood pressure. I am Dr. Sanjaya Kumar Shrestha, Professor of Cardiology. According to the WHO statistics, the number one killer disease among non-communicable diseases are cardiovascular diseases, which includes ischemic heart disease and heart attack, and stroke or paralysis, as well as heart failure. And there are a few important causes of cardiovascular diseases. These are high blood pressure, high blood sugar, and smoking. And high blood pressure or hypertension is one of the most important cause of cardiovascular diseases. According to one study in Nepal, 1 out of every 5 people who are suffering from high blood pressure, and less than 5% of them had really good control of blood pressure. And this is a very common disease, and to a large extent it can be prevented. As well as cardiovascular disease, ironically, is, though it's a number one killer disease, to a large extent it is preventable. And for that, the most important thing is to control one's high blood pressure, sugar, and stop smoking. Regarding high blood pressure, there are a few things one needs to know about it. The most important cause for high blood pressure has been found out to be high salt intake. And there was one study in Nepal that showed that the average intake of salt per head per day was approximately around 10 grams per day, whereas the recommendation by WHO is less than 5 grams per day, and the American recommendation is even less, that's around 2 grams per day, which equals to around 1 teaspoonful of salt. So looking at this data, we can see that our salt consumption is extremely high, way high than the recommended amount. So the first thing is we have to decrease our salt intake as far as possible. It has to be as low as possible. And another very important aspect of controlling high blood pressure is to do regular exercise, because doing regular exercise will dilate your blood vessels, and that will maintain your blood vessel tone, which is also known as vasomotor tone, within the normal range, and that will help decrease your blood pressure. And another important aspect is to check your blood pressure regularly, at least once a month. And if your blood pressure is persistently high, that is above 140 systolic and 90 diastolic, then you may need to go to doctor and confirm whether your blood pressure is persistently high or not, and you may need to start medication, as well as doing regular exercise and controlling your salt, or taking salt as low as little as possible. So these are the 3 things that has to be understood: low salt diet, regular exercise, and regular checkup of your blood pressure. Thank you.